Hi, everyone. It's Alex Savidge at KTVU, Fox 2 News here in the San Francisco Bay Area. And we want to talk about some of the concerns about coronavirus as we head toward the Thanksgiving holiday. And to do that, we bring in Dr. Maleka Stoll, a senior medical director with Blue Shield of California. Dr. Stoll, good to have you on here. There is a lot of concern about the spread of coronavirus here as people gather over the Thanksgiving holiday. What are your biggest concerns and what are you recommending to people?
Yeah, thanks for having me today. I'm most concerned that people are going to hold on to the idea of tradition and try and make this Thanksgiving like every other Thanksgiving. And of course that's natural. It is a time for tradition. And I think there's ways that we can celebrate that are going to be fulfilling, but they're going to have to be really different than in years past. It's just not the time to get together with people outside your household. And with the cold weather, during summer, we were able to gather outside and do that safely with our masks on. In winter, it's much harder indoors. And of course, when you're eating, your mask comes off. So I have concerns about that as well.
What if people are still, what if they keep the groups smaller for Thanksgiving? I mean, what if it's people who are, within their bubble or who've been in their bubble this entire time? Is that okay? And what sort of limitations in terms of size should people have on their Thanksgiving events?
That's a really natural question. And I think every situation's a little bit different. But the general guidance that I'm hearing and that I'm following at home is really just to stick with our immediate family. So even though, for example, my father has been a part of our bubble, I think it's safer this time around just to stick with our immediate family. Unfortunately, it is hard, but I figured, well, we can cook and drop off food the next day. There's ways to to keep it cheerful. We can certainly get on the phone and get on Zoom calls and wish each other happy holidays. So I think there's ways to do it, but I just really think we should go towards the side of caution and stick with the folks who are in your immediate household.
In terms of the travel situation, obviously Thanksgiving is one of those times a year when people like to travel across the country and see their loved ones. And I'm sure you've heard the recommendations from public health officials, from the CDC, urging people to avoid Thanksgiving travel this year. We're sort of getting into that window where we usually see travel start to ramp up and people starting to head out of town here. What would be your message to someone who has made plans to travel, maybe to take a flight across the country, but might be having some second thoughts right now about doing that? What would be your pitch to them about why it's the best idea to probably stay home?
I think it's a good time to listen to those second thoughts and to again have caution. Again, every situation is different. I can't speak for every single family and every single situation, but I think that if there is a voice saying maybe this isn't a good idea, that's probably the voice to listen to.
All right. You know as well as I do that there are going to be people who are still going to have Thanksgiving celebrations, in some form or fashion with some number of people. You hope it's a smaller number, but if people are going to do this, let's just say that they're set on the fact that they're going to have some sort of a Thanksgiving dinner with people. What beyond that? What guidance would you give them? What suggestions would you give them in terms of how to make that meal be as safe as possible and hopefully limit the spread of coronavirus?
Yeah, good questions. I think, as I mentioned before, outside's better than inside. So if you happen to live, in our climate in California, and you can set up some heat lamps outside, that's gonna be definitely more safe than being crowded inside. And even when you're outside, distancing. So sitting 6 feet apart, having, if there's a family there, they can sit as a unit, but then having them 6 feet from another family. You're going to have it set up that way. So little tables or whatever it takes. And I think making sure that there's not a lot of sharing. There's no sharing of utensils and sharing of food. So making sure, they're saying no buffets. Sometimes even potlucks, families can bring their own food and you still have that fun of gathering together. And then of course wearing masks at all the time other than when you're eating. So those would be my, that's what I would suggest.
Is there any benefit to limiting the amount of time that you spend? I've heard some people suggesting, well, maybe you try to make the Thanksgiving dinner, obviously it's nice to eat and linger and chat and have drinks and all that stuff. But is there any benefit to putting a kind of a time limit on things?
Yeah, the less time you're interacting with others, the less chance that the virus is going to spread. And of course, remember that you can have the virus and not be sick. So that would be another, obviously if somebody's not feeling well, if they're sick, they want to stay away from any type of gathering, and that's going to be really important. But even for those folks who look well and feel well, they can actually be transmitting the virus. So reducing that amount of contact, to your point, is the way to go. So shorter duration would be better. There's also discussion about alcohol, and when people drink, did the masks come off? Do people get a little closer together? That's an issue too. So again, I think limiting the time, making it short and sweet, that would definitely be advisable.
How do you, what is your gut feeling about how things are going to play out here as we head, into the heart of the holiday season here? There's a lot of sort of dire predictions about people still gathering over the Thanksgiving holiday. And then, you look a few weeks, a month or so down the line, and you might see a lot more people getting sick with the virus here. What is your gut feeling about how all of us as a broader community are going to handle this holiday season with cases on the rise?
Yeah, I'm an optimist, so I'm hopeful that as you said, the discussions that have been happening around just the surge that we're in right now, just really, really rapidly increasing cases every day all over the country, that people will take that seriously, and as they go into the holidays, do the right thing for themselves and for others. So that's certainly my hope. And I think, the other good news is we know more about this virus than we did maybe at July 4th, when people were talking about gathering, and we know how it spread. We know that masks are really effective, and so wear the mask. So we're learning more and we know more, and I think that's going to help us as well, as long as people, like I said, listen to that voice that's kind of telling you to do the right thing. And of course, as well, we have the recent good news about a vaccine on the horizon. But I do want to emphasize that that's not right around the corner. So we have, it's good news, because what it tells me is that next year for Thanksgiving, hopefully things will be back to those regular traditions that we love so much. But between now and then, if we want to get to that point and we want all of our loved ones to be with us at that point, then we really do need to do the right thing.
Yeah, absolutely. That's a really great point. And just because we have the vaccine, it doesn't mean that we flip a switch and all of a sudden we don't have to practice all of these safety measures and wear masks in the meantime. But I think you make a great point that it's about making, this Thanksgiving is going to feel different. It's just, it's going to be different, and we have to get through this one and look ahead to next year, right?
Absolutely. And there's, it's sometimes really hard in times like this to find those things to feel thankful for, but it's really helpful to do so. I think, with your family and friends, whether it's on the phone or not, just reminding yourself of what you are grateful for. I think that always helps, and that is the spirit of the holiday.
Absolutely. All right. Great advice. Really appreciate your time, Dr. Maleka Stoll, Senior Medical Director with Blue Shield of California. Really appreciate it. Happy Thanksgiving to you and yours. Enjoy your smaller celebration this year.
Yeah, you as well.
Thank you so much. Thanks for coming on.
Thank you.